All right, good morning. Hello, everyone. Welcome to our webinar on preventing burnout in nursing education. This webinar is really intended for our faculty, our nurse faculty, but we love to see those nursing students on this webinar as well because we want to bring both the faculty and student perspective. So welcome. My name is Hiva Kolodrubetz. I'm a family nurse practitioner. I've been an NP now for a little over a decade. And now I am an educator. I've been an educator, nurse educator for a couple of years, training the next generation of NPs. So welcome to today's webinar. We are streaming on our Instagram, we're streaming on Facebook, YouTube channels. So you guys can join from all those different channels. And for those of us joining in Zoom, you can go ahead and put your questions directly in the chat and we'll go ahead and get started. So before we jump into the content, let me minimize this screen so I can see you guys. Before we jump into the content, I just want to let you know, full disclosure, no financial relationships with anything we're going to share today. Myself and the other panelists, which will introduce themselves in a minute, we are all sharing things that we have experienced as nurse educators and research that we have read and uncovered, but there are no financial relationships a part of this activity. So without further ado, let's meet our other panelists. So I'm going to let Rachel Taylor kick off her introduction, and then we'll go to Dr. Hicks.
My name is Rachel Taylor. I'm our Director of Nursing Services. So I work from pre-nursing students all the way through that new graduate period. And it's absolutely my favorite because you get to see students who are really excited about starting work with them across their journey, really until they start as a new grad. But really what drives my passion in nursing education is trying to create change in this space to lead to where students feel really supported and feel encouraged and are not just crushing it on exams, but crushing it as new grads. And so super excited to be on our panel today.
Thank you for joining us today, Rachel. I'm so excited to have this discussion with you and Dr. Hicks. And Dr. Hicks, tell our audience a little bit about your background.
So, hello, I'm so happy to be here with my esteemed colleagues, Hiva and Rachel. As their guest, I am an educator, entrepreneur, you name it, I do it. I love this profession, and I agree with Rachel and Hiva. We do want to promote not only education, but a healthy and thriving experience and profession once you're done. So happy to be here, and I'm also currently the president of Texas Nurse Practitioners. So happy to be here today for this important discussion.
Yay, for all those Texans in the audience, we'd love to hear that. And before we get started, it escaped my brain because you know how it is doing 10 things at once. Put in the chat for me where you guys are joining from. I'd love to see what state, what schools, whether you're faculty or students, and where you are in your nursing journey. So this panel is really rich in its experience and its background. So both Dr. Tracy Hicks and Rachel Taylor, we've been practicing for a long time, and now we're on the education side as well. And so you really have the opportunity to ask your questions. We want this to be interactive panel. We'll have some themes that we'll talk about today, and we really want you guys to engage in those themes with us so we can really meet you where you're at and help support you with preventing this burnout in nursing education, because it's an important topic to really talk about. And I know burnout gets used a lot, but I really want to talk about what that means instead of just treating it as a buzzword. And what are some things that we can do personally as nurses, as well as nurse faculty and nurse educators to really build that healthy environment, not only for ourselves, but also for our students and our colleagues. That's really important. So the first theme that I wanted to have our panel talk about and have you guys weigh in from the audience is really the root cause of burnout. So I'm going to kick it off with, what are the most common early warning signs of burnout that you see in yourself or your students? And I'm going to be looking at the chat. If Rachel or Dr. Hicks, if you guys want to kick off with what you see as some of the early signs.
Yeah, I can kind of start here. I feel like there's kind of two ends to the spectrum. I was actually just talking to students about this. They either feel this need to be perfect and they like really start to overdo everything in a way where they're overthinking it, or they do the total opposite end where they just stop doing things altogether. They start to have a little bit of procrastination go on and they wait to do work, which then obviously leads them to having even more overload and worry as those dates get near for exams or whether it's an assignment. But I was talking to some students about it this past weekend at the California Student Nurses Association conference, and they were like, yes, I either fall in one or the other, and I can't seem to find a happy medium place. I'm either all in or all out. But they said both doesn't seem to be a good spot for them to be in because in both they are getting burnt out.
Yeah, 100%, Rachel. And you stole mine. So, absolutely perfectionism. I see it in myself. I see it in my students. That's a big warning sign, right? A big red flag because usually those perfectionists, and again, I put myself in that category. Those perfectionists really just want to do everything and want to do everything perfectly. And we all know now that that's just not realistic, right? You have to really weigh the pros and cons of what is going to be your priority now and shift those priorities, and really teaching that to ourselves and modeling that for our colleagues and our students is so important. Before we jump to you, Dr. Hicks, is my audio better? Rachel, I know you said my audio was a little bad.
It's still a little quiet for me compared to
Okay.
when Dr. Hicks is talking, but I don't
Okay.
know, Dr. Hicks, audience are you guys hearing Hiva okay?
I
I
will,
can hear you, it's just more faint.
Yeah, I can
I
hear.
will,
It's just a
we'll
little faint.
it. I'll work on it while Dr. Hicks is sharing her early warning signs. I don't know if I'm at
Well,
the
I think you guys have mentioned perfectionism, which is a very important contributor to early contributor to burnout. And also there's this imposter syndrome, and we've talked about that before. You know, you're in this competition and you feel like, should I really be here? But no, if you're in that spot and you've worked there, you deserve to be there. It's just that accountability piece. And again, another thing we talk about, emotional intelligence. I think some of the early signs that I see is not taking care of yourself. Okay. I think that's more of a routine for people. It's just not adding in that self-care piece. And then there's this sudden disinterest in things or a motivation or abolition, things you used to like to do, right? You're not participating as much, you're withdrawing from family. You may be snappy at family when, that's an early sign of, hey, I'm tired and I'm asking for help because behavior is a response to a need.
Yeah, absolutely. I mean, it's the snappy irritations, kind of like those first warning signs of depression that we see in some patients, right? It's not always that down and disengaged. Sometimes it's anger and like
Mm-hmm.
lashing out. So it's really interesting how different people respond. The other thing I was going to add to what both of you said is just like the workload demands, right? So some of those early roots of burnout, I think, are just not setting realistic expectations for yourself and not advocating for yourself in your role. And so sometimes that can come from role ambiguity. So maybe you're not getting the support that you need within your institution or wherever you're practicing. But really being able to say, okay, this is the workload demand that you've put on me. These are the realistic hours in a day. Where would you like me to prioritize my time? And I think
Mm-hmm.
being able, I think being able to do that, a lot of that is what you mentioned, Dr. Hicks, is part of emotional intelligence, right? Being able to recognize that it's okay not to be perfect. It's okay not to be able to do everything. And if you just keep saying yes to everything, that emotional labor really significantly contributes to the burnout.
Mm-hmm.
So I think the root of burnout is really significantly impacted by the emotional labor I think that we take on as women, as healthcare providers, as educators, as all of that, right? What do you guys think about that?
Yeah, I think, we talked mainly about students that first go around, and I think thinking about us as educators, we still are at risk for burnout if we are not careful and watching it closely. And I am a yes person. People on my team know I hate saying no. And I recently had a situation where I had to tell my team, like, I physically cannot do this as much as I want to. It's not right for me to do this. on our team. And it was hard for me. I was like, oh, what if this makes me not as strong of a leader? What if this impacts the team to where they think I'm not trying to show up for them in all the ways that I want to be able to show up for them? And it was this realization too of by me saying no, it allowed someone else to say yes. And it allowed somebody else to grow in their leadership. And I recently read something of, you're not a leader until you've created a leader. And it really kind of stuck with me of like, by us knowing what our own limits are, we help other people become elevated because it gives them opportunity they would not get if we don't say no from time to time.
I love that. I love that, Rachel. Saying no when you need to. And it's okay because again, good leaders create other leaders. And we can be okay with that. And then just effective communication, right? And sometimes you just don't feel comfortable. You're not assertive. And that's okay because that's something you can practice on and you can get better at is being assertive. Clarification. If somebody, sometimes academia, education can be really, a little bit fickle if we're going to be honest about it. And so just having that assertiveness to say, hey, this is what I'm interpreting from what you said. I'm not sure if that was your intent, but this is how I feel once you said this particular thing. And I don't think we're very good at that. And it's something that we just need to work on.
I think it's hard. It's what you're speaking to, Dr. Hicks, with, and it's what Rachel touched on too, is really allowing that spotlight to be on somebody else, being secure enough in ourselves to allow that spotlight and somebody else, because really the truth is there's enough space for all of us, right? There's enough work for all of us, and we're in
Plenty, surplus.
there's plenty. And I think being able to be such a comfortable and confident leader, like Rachel just mentioned, where you're like, you know what, I'm going to give somebody else the opportunity to also shine and also be in this leadership role, I think goes a long way in creating really a healthy environment and preventing that burnout within your team and within your group. So 100%, I think in nurse academia, I'm sorry, I'm going to cough. In nurse academia, it's so hard because I think, like you mentioned, Dr. Hicks, if we're going to be 100% honest, it's cutthroat sometimes, right? There's a lot of people wanting to grab credit, and there's no need for that. Really, it is a big enough world for all of us. So I really personally want to see that shift as we're continuing to have these open and candid conversations about education, right? All right, so before we jump on to our next theme, I want to discuss one more root cause of burnout and get both your, Dr. Hicks, and Rachel's take on this. What about this hybrid online post-pandemic world? How has that shifted the landscape? Has it made it easier? Has it made it more stressful? Do you think it's one of the roots and contributors to burnout, or do you think that's helped us on the nurse faculty educator side? What do you guys think about that?
I think there's a lot here to unpack. Like, I think this in itself could be a whole panel discussion, in my opinion. I think number one, students did not get the same opportunities during the pandemic that they did outside of the pandemic. And so I think there is this extra need for new grad nurses to have support, to have really, really strong individuals that are mentoring them, because they might not have some of the skills that the nursing student had before the pandemic, simply based on clinical sites were closed. There weren't as many clinical options, and that kind of changed the landscape a little bit altogether. There's also been this shift to doing more virtual simulations and doing more simulation based along with clinical hours, which I think are great, but it's when those start to replace those clinical hours that I think students start to feel less confident in themselves. What I think I've seen the most of is students who just are not confident in their skills. They're not confident when it comes to testing. And it's when they feel supported, encouraged, and that they have someone walking alongside them, when they have this confidence, that I feel like it actually helps them overcome the burnout and prevents this stress that leads to burnout, or at least aids in it. But I think that takes awareness from everybody, experienced nurses on the floor, whoever their manager is, to really come around these newer students post pandemic to make sure that they are confident, they have the skills they need to really thrive. Because if they don't have those, I don't know that it's necessarily their fault that they don't have them, but it definitely leads to a lot of extra stress, which leads to burnout. I mean, if you look at new nurses, the number that leave the bedside in the first 2 years, I think speaks volume to this. That rate is incredibly high. Sometimes it's every one of 3 nurses in the first 2 years of practice are leaving the bedside. And I think we need to think collectively as a whole of how do we help prevent this? How do we surround these people so that they're staying in the profession longer? And burnout is one of the causes of why they're not staying at the bedside.
Yeah, 100%. You're right, Rachel.
I think those are all great points. But when we're talking specifically about hybrid for education, and if we look at hybrid versus online education, right, that human connection piece is so vital. Um, and people say, oh, it's more convenient, if everything is online. Well, there is merit and research that supports that human connection piece, that building of those relationships, that foundation that you need. And so I think hybrid, of course, there's different schools of thoughts, but there needs to be human interaction in education. It just, has to be how we do that. It's going to look differently. I guess we can look at standardizing it, but each population is different, and we have to respect that. Person-centered and individualized approaches are key.
Yeah, 100%. Dr. Tracy, you're talking about what we touched on in our last faculty webinar, which is the research that shows that actually the hybrid model for our learners is quite effective, if not more effective than when we had just in classroom. It's just the way we do it has to be intentional and really helping build that engagement in that community. And as nursing faculty, we're the ones that set that expectation and set that culture. So we really need to make sure that we're building that
Population is
with our
different, and we have to
students.
respect that.
Oh, are you guys hearing my audio a little bit better? No.
No.
Okay, I'm trying. I'm not the most tech savvy with when something
When
does
you're
pop.
that close, it's a little better. Maybe you just need to sit
Okay,
that
maybe I'll
close.
just like hover into my
Yeah, that's better when you hover,
you guys are
like
Yeah,
gonna
when you
get
hover,
really
it's
up
better.
close and personal.
3D,
Yes, hello.
3D.
Hi. All right. Are we good to jump to the next topic, or does anybody want to add to that? I'm trying to keep track of all the different chats. Rachel, I think you're being really good about like responding to people's questions and stuff. But any
Yeah,
other
I'm on
questions?
them all.
Yeah, you're so good. Thank you. I'm hearing a little background noise. I think whatever I played around with did not work. So I apologize. Okay, let's go on to our next topic. And see, owning up to when you don't know something, I think is really important too. It's in my notes for a later topic, but it's in here somewhere. We'll get to that, I'm sure. So the next theme I wanted us to talk about is really how do we create that supportive learning environment, and talking about spaces that actually feel welcoming. People can feel like they can ask questions, ask for help. So as faculty, how do we intentionally create that safe culture and that openness in whether it's a classroom environment, a hybrid environment, a clinical setting? What do you guys think? I'm going to open it up to the panel.
Well, I can give you an example. In one of my courses in mental health, we do what we call a seminar. It's like a flipped classroom, right? The student does the research, they come in with that information, and then we have a discussion. And for me, I'll give myself as an example, as faculty who have, lived experience with serious mental illness, I was comfortable. I'm not saying everybody's going to be comfortable with that, but when you build a culture of safety that says that I can be vulnerable as faculty to my comfort level, of course, I'm not suggesting everybody tell their business, but is that sometimes for me, it's been cathartic talking about my personal experience and, helping to cultivate great providers. And I've had many students say things like, I'm so glad you shared that, because students see us as faculty as perfect, that we have nothing going on, that we have all the information. And so I cultivate an environment saying that, hey, yes, I have a few more letters behind my name. In fact, the alphabet soup, as my kids call it. But I am dedicated to lifelong learning. So we are here learning together. And so I keep that environment, that psychological safe piece there.
Yeah, I love that. Just showing people, showing your students that you're human and it's okay to make mistakes and ask questions and the hardships that you've gone through as well. And they can identify with that and feel like they can have those open conversations with you. I think that's lovely. That's very nice.
Favorite thing to say is in nursing, the standard isn't perfection, it's excellence. And we get the two confused often. And if we try to shoot for perfection, we'll never reach that goal. We will fail every single time. But it's when we shoot to be excellent that we can achieve that. We can achieve excellence. And that doesn't mean we never make a mistake, but like you said, it's when we own it. And so I really think when we create a culture of safety, what we do is, one, I've lectured before and I've said the wrong thing and I've needed to correct myself and say, hey, I just said this wrong. This is the right information. What sometimes we want to internally do as educators is just like slip by it and be like, maybe no one noticed that I said this wrong, right? But instead, when we own it, it builds so much respect with students. At least that's been my experience. Pretty much anytime I've made a mistake, they're like, thank you for owning that, because it, again, yes, it makes you human. And then the other thing too, I think, is finding that the more open students are with me, the more I'm able to help them, just like with our patients. They start to become more open. I'm not here to judge you, but if I understand what's going on, I can help you through this challenge. Hey, you have an assignment late from 2 weeks ago. Why is that late? Like, what's going on? This summer, I was teaching an intro to nursing course, one that I plan to teach again in the new year. And I had several students who just weren't turning in any of their work. And I emailed all of them, reached out, wanted to have a conversation. Several never emailed me back, but the ones that did ended up being successful. And so I think it shows that when we show we care and we work to build that connection, their effort in class starts to come up. And I really saw, the students that did reach out to me, they started turning in their assignments. They were able to be successful. They were more engaged when we got to the clinical experience portions. But again, there were some who never responded. And that was really kind of that hybrid model. It was online for classes and we only did lab and clinical in person. So it was several weeks until they met me in person. But it seemed like our class strengthened when we had that in-person connection. And it definitely taught me ways I could do that course different the next time to make sure they get that in-person interaction sooner, to kind of prevent that delayed start that several of the students had, that some of them couldn't come back from because it affected their grades so much.
Yeah, experience goes a long way, and you continue to learn and allow yourself to adjust and adapt. And if you are teaching the same course, which is nice, you can really take what you've learned from previous semesters and apply it and take the feedback as a gift. I hear that and I'm like, yes, feedback is a gift. Like, let's actually ask for real feedback. And I want real feedback, right? So I can make this a better experience for everyone. The other thing that one of our attendees said, Sherry said, and admit when you don't know something, right? How many times as faculty, as new faculty, or as a new educator, I remember I'd be so stressed, feeling like I had to know everything. And so when I was meeting with a student, sorry guys, getting over a cold. When I was meeting with a student, I would feel like, okay, I had to be extra prepared, study everything, and I have to know all the answers. When in reality, we all have our own strengths and weaknesses. We all have our own clinical background. You can't possibly know everything, right? And I started to learn that I didn't have to hide this from my students. In fact, if I taught them how to look for evidence-based answers and research, so that when they're in clinic, when they're faced with the same problem themselves, they know how to navigate that, it's actually a lot more beneficial to my students than if I just pretend like I know everything and just make it up as I go or whatever. It's actually a lot more beneficial to say, hey, I actually don't know the answer to that. Let's try to figure it out together. And I'm going to show you what kind of resources I go into to get the right answer. Because a lot of times what I'm finding with my students is they're looking at like videos online, and it's not that they're maybe using certain AI tools and taking that as fact. You really have to teach the next generation, the current generation, with all the different tech tools, how to actually get the right answer and not misinformation. So that's an important skill to teach students as well. What do you guys think about that with all this technology and how students want the information now?
Hmm. I think that's an interesting topic. Well, with the advent of AI and it's coming for us, and we've got to get ready for it, and just having those conversations. And what is our policy for this, and how do we discuss it? Because understanding that students are probably take advantage of things like AI, how do we tell them? How do we cultivate an environment of academic integrity Like, how are you using that AI? How are you using that technology in your education, right? Because this is going to bleed over into how you navigate professionally, right? So we can't say, okay, this is not coming or I'm not comfortable with that. It's here. So how do we
It's
navigate that?
yeah, it's not coming, it's here, and students are using it. You're absolutely right, Dr. Hicks. And come to my talk at AACN Transform 2025. I'm talking on this because I was the biggest skeptic with AI and using AI, and now that I've been forced to do it for a year, I actually embrace it. And I think once it starts with us, it starts with the faculty. Once we know how to use it, once we embrace it, once we figure it out for ourselves, we can guide our students on how to actually use it safely and to help them improve their understanding, right? Not just be doing their work for them. I'll leave it at that. Rachel, do you want to add anything before we jump to our next topic?
I think my only big thing on AI, just from being like a recent student myself, when I graduated with my master's in nursing education this summer, it was very different on how faculty allowed the use of AI in my courses. I had some faculty were like, yes, use it, just make sure you cite it if you've used it at all. I had others that were like, if you use it at all, it's an automatic fail in the class. And so, what I think is really important for us as faculty is being on the same page in an institution of like, how are we going to allow students to use this? I will say, from my own experience using it, there were ways that it helped me be better. It wasn't that it was just doing the work for me, it just helped me be better. For example, it would review things I wrote and tell me where my gaps were so I could strengthen my own writing. And so I think it's
Absolutely.
really important that we as educators show students this is how we use it successfully to benefit you. But if you use it this way and it's unchecked, it can actually hurt you. And I think helping students realize that is
Absolutely.
really important.
Yeah,
Said,
100%.
what is that policy and how are you using it? Yeah,
Mhm.
Yes, yeah. And modeling it for ourselves, we have to be comfortable with it if we're going to guide our students on how to use it. Yeah, absolutely. So we got into talking a little bit more about AI when we wanted to talk about how do we intentionally save that culture of safety. But I think you guys touched on that. So really being open and vulnerable ourselves as nurse faculty really sets that tone in that environment. And when students feel psychologically safe, to interact, that's actually key for resilience and engagement and really reducing that emotional burnout that we've been talking about. All right, going to the next topic. So, building resilience and self efficacy. What do you guys think? This is a topic that I love to talk about, but I'm going to let somebody else go first. But what are those strategies that have helped you? What are those strategies that have helped your students really bounce back when they've had those setbacks or those life stressors, academic stressors, whatever it may be? What do you guys think?
So my main focus at Archer before I got in my current role was our repeat test taker. So anyone who had failed their NCLEX before, or maybe was unsuccessful in nursing school, that was where I really came in. That was my area of expertise. And what I find is that students very often attach their self-worth to what their test grades are, what their scores are. Did they get a pass? Did they get a fail? Especially when it comes to the NCLEX. I have students who fail the NCLEX who come to me and they say things like, I'm not worthy of being a nurse. I can't believe I'm so stupid. I'm not smart enough to do this. They are mean to themselves, not intentionally. It's just, it creates all of this emotion that they don't know how to deal with, to the point that some people even walk away at this point. And so, what I think is really, really important is that you meet a learner at that critical moment when they are most emotional, when they are at that peak of self-doubt, and say, hey, this is not a reflection of you as a whole. This is not a reflection of you as a human being. This is showing us your gaps. We can strengthen those gaps and we can help you be successful the next time, but your self-worth is not attached to that. And we need to separate these two things out. And yes, you can have your moments where you're feeling all the emotions, but I like to actually give my students a timeline for that. Like, let's take 24 hours to deal with this emotionally. And then once you have dealt with it emotionally, we're going to push forward and let's work on a plan together so that you're pushing forward. And I also give them, which this is where I don't set a boundary of, reach out to me at any time if you are struggling, if you're having doubt here. I've had students who have, taken sometimes years after an NCLEX attempt before they come back. and they finally feel supported and they go on to be successful. And so it's really about meeting them where they're at. Yeah, Sherry said, sharing a personal experience of failing a course in the NCLEX. Yeah, I got a 40% on my first A&P test I ever had. And I called my mom crying and I was like, I can't be a nurse. There's no way. I don't even know basic A&P apparently. We totally attach our self-worth there. And I ended up doing totally fine in the course. But we have these moments that we have to share with students. I had plenty of times in nursing school, I almost walked away and thought it wasn't for me. I've had times as a new grad where I questioned my abilities. I've had times as an experienced nurse, I've questioned my abilities, but it's about what we do in those moments and really reminding students that we all have hard days, but it's about making sure instead of fueling our self-doubt, we find ways to fuel our self-confidence. Which Hiva, I don't know if you have any suggestions of how you really help students fuel that confidence a little bit further.
I'm going to let Dr. Hicks talk about this because I feel like I could talk for an hour and then I'll share mine. But absolutely, it's something that I personally have experienced, and I'll share that in a minute. But I have a love of mindfulness that some of you may know about. But go ahead, Dr. Hicks, share your.
Well, so I'm going to point out Sherry here. She said, I share with my students that if you fail, that will not define who you are as a nurse. And she said, I share my personal experience of failing the course in the NCLEX. And that kind of spoke to what I said earlier about, the comfort with being vulnerable and transparent and sharing your experiences. And we're not super heroes here. Yes, we want to consider ourselves, but we are imperfect as well. And we've had our trials and tribulations, and sharing that with the students, is key. And I also tell students, delayed but not denied, and understand that, okay? Because you have to take care of you first, and you cannot pour from an empty cup. So understanding where you are, noticing triggers. And again, what we talked about earlier, those early signs of burnout. Are you snapping at family? Being self-aware, again, that first component in emotional intelligence. What's going on with me? Is this, sometimes I may need to delay some, but I'm not denied. I can do this later if I need to. But understanding we're not perfect. Mistakes happen. Life inevitably happens. So what is your plan for it? Sometimes the plan doesn't go as you plan. Again, but just understanding that resilience piece and knowing when to roll with the punches and knowing when, hey, I may have to take a few steps back, and communicating that. We don't communicate enough. And understanding with resilience in education, as a student and as faculty, you cannot wait to the last minute to communicate an issue or a life issue. You have to, step in front of it. This may be coming. I think this is coming. Some things are not in our control. But again, communication when you can, as early as you can, is key.
Yeah, it's really hard to be vulnerable, especially in front of your colleagues or your boss. You want to be seen as doing it all, or maybe you're stressed out about work performance. Maybe there's a review coming up or a promotion, or um, but it's part of being human. It's part of having that emotional support at your job, right? So if something's really feeling like too much, you should have the ability to speak up. And if you don't, then maybe it's really not the right environment. But I think if we all start to really do that and exhibit that and model that, I think it's going to be really helpful.
Oh,
Go ahead.
Oh no, I was just going to say Hiva, that you hit a hot point for me, and I just want to make it really quick. I've been in academia, starting at the community college level for a long time, and if respect is not on the table, I remove myself from that table. So that may mean I need to do something differently. Now, do I do that professionally? Of course, but you have to know when a situation is not conducive to you to be able to thrive, because we talk about this word resilience, but sometimes I ask, how resilient do you want me to be? You know, I need
Who are you
respect.
asking that question? Are you asking like globally if we really want to get like how resilient do you want me to
Yes,
be?
I ask that in my talks. I mean, because we say, okay, you need to be resilient, you need to be resilient, but some
Yeah.
people interpret that as I need to take this, I can do this, I don't need to say anything. I may need to, no, you have to question, okay, is
Yeah.
this level of resilience, is this request too much for me?
Yes, there's a fine
We,
line.
we talk about suicide and things like that. That's where those things happens because people try to be resilient, but sometimes resilience to a certain level is not the answer.
No, I think that's true. There's a fine line between resilience and abuse and being taken advantage
Mhm.
of in your workplace environment. So you really have to be mindful of that. So 100%. I don't think I've learned over my years that walking away is not always the best choice,
Mhm.
because then
Mhm.
that can lead to a lot more emotional burden and
Yeah.
hardship. But knowing that, okay, you know what, this is what I'm going to try. I'm going to be
Mhm.
open and honest. And if you really feel like you've gone all the avenues and had those
Exactly.
conversations and it hasn't changed, nothing's different, then you have to know when to walk away, I think. Uh,
And I think clarifying in those situations is super important because I am an overthinker. I'm just going to share with you all here today. I will overthink every little detail. And so if someone makes like an off comment to me, or I have a question, or I didn't quite understand it, what I used to do was I used to overthink it, and I would end up putting some blame on myself that technically I did not own, and that wasn't even what they intended and what they said to me. But my overthinking brain naturally goes down a lot of rabbit holes. Okay. And so, what I have found that I have to do, and what I even advocate for my team members to do, or what I advocate for my students to do, is go have a direct one on one conversation where you can see their face, whether it's a Zoom, whether it is, face to face, not even just a phone call, not email, but actually be able to see their face. Because what I find time and time again is when I can see emotion attached to their words, I get a totally different perspective to what is going on, to where I'm just reading a message. It looks very different.
Yeah, it's
Yeah.
hard. I think with this hybrid and online model, a lot of the newer generations, this is something I was going to mention earlier, and then that's what escaped my brain. But a lot of the newer generations really find it invasive to have those face-to-face conversations, and you can learn a lot about what that person is saying by having those interactions and being able to see their facial expression, their body expression, even like in person versus on a video. So it's really hard to communicate across different generations too, and how they want to be communicated to. But absolutely, really figuring out the intention and not taking things personally. And then, Rachel, think about all that emotional burden that you carried, how exhausting that must have been, because you're just replaying it over and over again in your mind. So that's one of my resilience building programs that I've been personally practicing for the last, I think it's like 3 years now, maybe a little more, is mindfulness. So really being mindful
Mhm.
of what's happening in your brain and being able to say, okay, like this is just a carousel of thoughts, the same thoughts over and over and over again.
Mhm.
And that really does take an emotional burden on your body, on your brain. I mean, it zaps your energy. So being able to not necessarily change it, but be mindful of it, be aware of it, recognize it, appreciate it, and then say, okay, I'm going to set that aside for right now. I'm sure I'll
Mhm.
come back to it. You know,
Yeah.
that recorder's going to come back. Don't worry. Trust that it'll come back. It's not going anywhere. You know, we're worried. We're like, I have to think about this over and over again so I don't forget. Nope, it's going to come back. Don't you worry. And
Yep.
then just really being able to
Exactly.
set it aside and take care of yourself and recognize those early signs really has helped me bounce back when I have stressful situations or setbacks. I think that's important. Yeah.
I
Has
think mentorship too. Having a good mentor where when you're having those overthinking episodes that Rachel mentioned, you bounce it off somebody and they have a different perspective and they think, oh yeah, you may be overthinking that. Just let me tell you why. And don't be afraid to ask why if somebody tells you. So what makes you think that? Tell me more about that.
yeah.
You okay with learning about yourself?
No,
Love that.
I think that's 100% true. Yeah. All right. Any other thoughts on this topic before we move on to the next one? And I did turn on captions. I don't know if it worked, guys. I'll have to sit down with IT and be like, what did I do wrong? But I turned off streaming Instagram and TikTok, hoping that
Oh,
would
that's
help.
good. I hear you. I
You
hear you
hear me
better.
better? So I
Yeah.
think that's it was just because of all the different streaming channels, and everybody on TikTok and Instagram seemed to be getting frustrated and hopping off. So I
Yeah,
I went
they
ahead
can
and turned
only
that
hear
off.
you if you stream on the others. They can only hear
Yeah.
you.
Yeah,
Not
so
us.
we're still streaming on the YouTube channel and the Facebook channel, and we're on Zoom, but I think that should help with my audio as well as the audience frustration. So make sure you guys are joining us on some of the other channels, not Instagram and TikTok. Okay, so moving on to our next topic. Let's see. So institutional culture. This one I think is really important to talk about because sometimes, I mean, we've already kind of touched on this, but sometimes it's out of our control, right? So how do we really help our organizations really mitigate burnout as opposed to worsen burnout? So systemic issues, workload, lack of flexibility, those are some areas, large areas where we can contribute. We can either contribute in a positive way or in a not positive way. So what are some thoughts? Like how can we really help our institutions balance the rigors of academia versus the expectations that we have of faculty and our students?
I think Rachel mentioned it earlier, the art of saying no, but not just saying no, actually giving the reason behind the no, right? Because we're asked to do things like navigating extra workload and things like that, but just pointing out, what you can handle and having that information ready because you don't want to be that person that's, no, 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 without the rationale behind the no. It's okay. I like being able to say no, but I also want to point out what I'm saying yes to.
Mhm. I like that. So point out what you're saying yes to and point out why you're saying no. I like that. And it
Hmm.
also justifies it for myself. Be like, look, this is what I'm working on. It's not that I'm not working hard for you guys, right?
Hmm.
Like this is what I'm doing for us, but I'm human, right? I'm only
Hmm.
human. And being
Hmm.
okay with that personally to really say those words out loud and live it. I
Hmm.
think that's important. Yeah, Rachel, what do you think?
I have had times with my team where we have this, what feels like this big task of, hey, here's the goal for the next month, or maybe it's the next 3 months. And when you first look at it, it feels impossible, right? It's like, there's no way we can achieve this. It's not possible. But when you actually broke it up by team member, by person, by day, it was like, oh, this is so doable. And so I think part of our role, especially as leadership in faculty, is to help people with that of like, yes, here's the big to do, but when we break it down on a smaller level, this is the daily of what it looks like. Is it possible or is it not? You may break it down to the daily and be like, there's no way this is possible. It doesn't fit into my day. And then it's, hey, is it priority or is it not? But you may find that it fits into the day a lot easier than when you were looking at it from the big picture. And I've just found with my own team of helping them break that down and what does this look like? How can we reprioritize to make sure we're on the same page is really, really helpful. And then two, it might be me telling them, this is no longer priority. This is going to take its place. So you can move that to a month from now, but this is what I need you focused on right now. And I think we sometimes as leadership, we have to give that guidance. And so maybe you're sitting from a place where you're like, Rachel, I'm not the leader. I wouldn't be able to deprioritize or reprioritize something. Ask your leader that. Ask them, what is my priority? Where do you want me to focus? And it can help you limit that workload. Or if you get this workload where you're like, this is not feasible for where I'm at in my life, again, breaking it down, showing how you've already ran those situations and saying, hey, this is what I can't accomplish on my own. Is there someone on the team that could support me in this? My other big thing is I find when I have a team I'm working on something challenging with, I do way better than if I'm trying to do it on my own. Um, I don't know that I always realized that. Probably in the last year, it's been something I've realized. And so sometimes I just need to talk it through. So it's like, hey, Hiva, can we get on a call so we can talk this through because I'm stuck because I don't know where to move forward. But then in reality, after a 20-minute conversation, I'm good to go and I'm ready to move forward. And so I think sometimes it's more of that communication of it doesn't feel realistic, but it is once I'm able to talk it through and have had time to digest what that task or what that issue might be that I need to solve for.
Yeah, 100%. And I love those conversations with you, Rachel. So it's really nice because I work that way too, but some people don't. There are people, my colleagues that I love on other teams, and they hate it. I'm like, hey, you want to talk this through? They're like, please, why? Like, what questions do you have? Like, just go do it. So I think knowing what you need and knowing who you can go to within your team is really important. So you guys talked a lot about breaking down that workload. I wanted to talk about flexibility, lack of flexibility, but I also think too much flexibility gets a little bit dangerous, especially when we're talking about our students in this culture, in our current culture, where there's a lot of, I think, over accommodation. I think that can also lead to a negative culture because that adds stress. It adds stress to the faculty, feeling like I have to accommodate everything. Is this a reasonable accommodation? Is this reasonable flexibility? So, what do you guys think about that with the current culture of being sensitive to every student's needs, but not necessarily bending over backwards? And how can we communicate that to our institution that's trying to make sure we're compliant with accreditation and all of that?
I think Rachel said it earlier. The guidance and communication is key. This is the expectation, this is the timeline, and then actually guiding people on, hey, I had you on this project, but maybe we need to, switch gears on this and focus our efforts on this project. So just that open line of communication is key. And, you know, it all boils down to and back to communication. How do we communicate it? What are the specific needs? When do I need this done? The how, when, where, and what.
Yeah, absolutely. Rachel, any thoughts?
I think with students, it really comes into play here because I think of students who are like, I'm turning this in late and they expect to get full credit. I have a rule that I tell students from day one of me meeting with them. If you communicate beforehand, the chance of me making an exception is there. If you communicate it after the fact, I am not making an extra exception for you. My kind of pet peeve is students who like 2 days later will be like, well, this big life thing happened. And I'm like, you could have texted me 2 days ago and I would have known. Same thing, with my role at Archer. It's very clear from the beginning of this is my expectation. And if you don't show up with this expectation, we're not going to have a successful of a session working together because I need you to do your part. What I really like to advocate to students is that they're in control of their learning. Doesn't matter what instructors they have, doesn't matter what clinical sites they're at. They are in control of their learning experience because that's what they can actually change. They can't change what instructors they get. They can't change their clinical sites. But what they can do is they can change how they communicate with their instructors. If something isn't going well, they can give feedback. They can go to their clinical sites and say, hey, I'm here today. These are things I'd really like to learn. If anyone has one of these things, can I watch you? Can I do this? Or I'm working on this skill. Let me know if you see it. And what I find is when you help a student see that they're in control of their learning, it changes their whole perspective. I sometimes get students who come in with like a blaming mindset of I didn't do something and that's why they aren't successful. But I see when they shift that mindset to now they're in control of it, they're like, oh, yeah, you're right. I did not do X, Y, Z like you had suggested. What can I do now to kind of alter my direction or my course? And I think it gives them so much more ownership. And honestly, that's life, right? Like they're going to have control of what their career looks like. They're going to have control over how they respond. They maybe can't control someone else's response, but they can always control their own. And I don't know that every new student has that skill. And sometimes we have to kind of help build that in them and help make them aware of that.
I love that, Rachel. It's so ownership of your behavior as a faculty member, teaching that ownership to students in their own education. Love, love, love that. And setting those expectations, as both of you have said. So moving on to our last theme, we're going to talk. Did it jump too many? I'm having trouble with my keyboard. Is it on the right slide, Rachel? With the
You can go, are you
integrating
still wanting to be on institutional culture?
No.
Okay, then you need to go one forward
As
if
if
you want to be on integrating well-being.
How funny. Why is it doing this? So it shows me it's on integrating well-being, but that's not what you guys are seeing.
There we go. It's there.
There
It
it
caught
is.
up.
Oh man, I'm having tech difficulties today, guys. All right, so jumping on to our last topic, we're going to talk about integrating well-being. So how do we really make those small but meaningful changes as educators to really weave in well-being? How do we teach it to our students? What do you guys think?
First, you have to display it.
Yes, 100%. Yeah.
You have to display it. That's the key indicator. But look at that. Mindfulness, exercise, reflective journaling, promoting that. And how does that work, right? Because I tell my students, this is how it works for me. Every day is not a good day for me. I don't know everything. I know a lot of things, but I don't know everything. And just letting them know it's okay not to know everything and not to expect us to know everything,
Yeah.
but understanding the importance of filling your cup before you're trying to fill all these other cups.
Yeah, I agree. I remember I had a nurse faculty who made us journal in nursing school, and everybody was like, ugh, like rolling their eyes. And like it was something that they had to do with everything else that was more important that they wanted to be doing because they had to learn all this content. And I didn't appreciate it until now with the world just being so much faster with all this tech. And I'm like, oh, maybe that's a good thing to work back into your curriculum. Like, you don't have to turn it in. This is for you, but maybe we're going to set reflective journaling into the curriculum. Like you should be doing a couple of posts or whatever you want to call it, entries, a couple entries a month, and really talking about those hard cases that you're seeing in clinic, really
Mhm.
talking about those hard days and reflecting on that, right? And then if there's anything that you want to talk about, coming to your faculty and saying, hey, I had this really hard case and I want to talk about it.
That's excellent, Hiva. I include that in I teach diagnostics for mental health, and I include that reflective journaling. It's key. And they can go through and they can talk about different things and how they're applying this or how that made them feel. And it's been a game changer.
Do students like it or do they roll their eyes?
They rolled their eyes at first at the thought of it, but once they did it, they understood. And I'm really good about asking, okay, how was that for you? Because we're asking them to reflect, but how is the art or the assignment affecting them? So,
Yeah.
that feedback is key. And I tell them, use your evaluations. Tell me about assignments. In the midpoint, there should be a point in there where they can give feedback on the course, what's going good, what's not going so good.
Yeah, I think it's hard. Every time I try to implement it, my students definitely roll their eyes. But I think that's just me because I'm super hippy dippy or whatever you want to call it. Like, I always want to
It's
talk
how you
about
sell it.
feelings. I guess it's how you sell it, but I'm like, come on, guys, like, and nobody wants to go there with me. They're like, oh, like not again. But maybe it's all how you sell it. I'm not selling it well. Maybe I'm too nice. Like, I don't know.
I think they
No.
appreciate your enthusiasm. Once they do it, they can probably see.
Oh my gosh, you know me and my enthusiasm, Dr. Hicks. I told my daughter, she was
It's
talking
beautiful.
about this just to go off topic for 2 minutes. I was talking to my daughter about her enthusiasm. She's like little mini me. And she's like, Mom, I'm bouncy all the time. I'm like, yep, that's your superpower. Let's talk about that. Like, that's okay. You shouldn't diminish that, right? You shouldn't feel bad
Yeah.
about that. But there's a time and a place to be bouncy. So,
Don't feel bad about it. Figure out how that talent fits into the fold, right? We
I
all have our talents.
Yeah, I agree. Rachel, do you want to add anything to integrating well-being before we jump to our last few slides?
Yeah, I think the biggest thing I talk to students about here is just how they talk to themselves. And I know we talked about mindfulness, but I start to phrase it as how would you talk to your best friend, to your sister, to your kiddo if you have one? And what I find is pretty much everyone in the crowd is like, yeah, I don't talk to myself that nice. Like, I don't motivate myself that well. And I see this major change in students when they change that inner thinking, because when we start to think thoughts all the time, that becomes truth. When in reality, if we change that mindset, it can be huge. And really giving them the power of this is going to take time. You have to be aware of it. But if you consistently do it for a period, it becomes second nature and it gets a lot easier. And I think that's what helps them when they get into the nursing profession, whether undergrad or, postgraduate degrees, is they have this tool then that sticks with them, for the rest of their lives. But it takes them time to get. It's not like you can just do it tomorrow and you're good to go. It takes intentional thought.
Yeah, I love that, Rachel. Like I read somewhere you will never talk to anyone as much as you talk to yourself. And when I read that, I was like, oh, wow, that's true. Like the inner monologue and the dialogue that is constantly there is I will never talk to anybody as much as I talk to myself. So I better be nice to myself. And we're usually not nice to ourselves, but we're nice to everybody else, right? So I think even as faculty, when we're dealing with difficult situations with our institution, with our students, really looking at it from that perspective of like, well, how would you guide a colleague on this issue? What would you say to a colleague? What advice would you give? I think it's a nice way to reframe a difficult situation so that we can really guide ourselves through those difficult situations. I like that a lot. Yeah. All right. Well, with time in mind, if my computer will cooperate, I'm going to try to jump to this last slide. Why is it doing this? Did it go to our last slide?
Now into our NCLEX information. So I can share on that if you want to do the NP
Sure.
information.
Sure. Yeah, go
Uh,
for it.
so Archer, we really support students across the lifespan, but really where a lot of educators and probably some of you here have heard your students talking about is our NCLEX platform. The reason our NCLEX platform is so well known is one, we keep our information really updated, but we don't just want to say, here's a product, good luck with it. We'll talk to you after you use it. It's we want to partner with you and we want to see your students and you be successful. We want to take some of that workload off of you to where you know that your students are getting the prep that they need for their NCLEX, but lasting longer than just their NCLEX, lasting into that new grad period so that they're successful. We really focus on critical thinking, clinical judgment with our unfolding case studies, our NGN content, as well as we do Monday, Wednesday, Friday live lectures for students that have our SurePass package, because we find that the more human interaction they get, the more engagement they get, the more likely they are to be successful. So if you ever have a question, one, you can always reach out to me, rachel.taylor@archerpulse.com, or to our sales team if you're ever interested in helping your students get this incredible resource.
I love that. And Rachel and I were just joking in a meeting this morning. We're like, we give out our personal email all the time because we genuinely want to hear from you. And they're like, I wonder at what point that will shift because we just can't handle the number of emails that come in every day. But honestly, like we read every single one, and I love hearing from educators, students who have tried our products. It's really nice to just hear from you guys and get that feedback. Feedback is a gift. And you should be able to see the NP information now. Is that I think I clicked out of something when I was trying to click out of Instagram and TikTok, but you should, Rachel, are you seeing the right screen?
Yep, it looks
Okay.
good.
Cool. So we're building out a lot of our advanced practice products right now, including these faculty webinars. So I really want you guys as educators, this is for educators only. This is a QR code where you can scan it and get a free demo of a lot of the content that we're building out. And you can partner with us and really give us that feedback, tell us what you need, and really have something that's going to be useful for you, right? That's our goal. We want this to be useful, meaningful. We're not just teaching to the test, we're really teaching to clinical practice. We need more clinicians in the workforce, so we don't need students passing the boards and then not being able to actually practice in clinic. So let us know how we can help you. It's a quick little survey. I think it just asks for your name and email and what you're looking for, and our sales team will send a demo. But if your students are looking for a test prep, myself and Dr. Boosie, who's not on today's panel, but also a wonderful experienced educator, she and I do these board power preps is what we've been calling them, what we've been told to call them from product. But it's a 1-day review for boards examinations where they also get over 400 slides from our presentation that day. They also get a workbook that they can practice on. They get the recording. So it's a really nice offering. I have to be honest, I was also a little skeptical at first because we used to have a 3-day live review. And I said, how can you do a review in 1 day? But once we took our 3-day and Dr. Boosie and I really boiled it down to 1 day, it actually is a really nice high yield review where we've gotten a lot of good feedback and students really like. We're not teaching it. We're just saying, this is what you need to know for these body systems. If you don't know it, again, that ownership that Rachel talked about, you need to go back and learn this and then come to us with questions if you need help. So it's really important to really put that ownership back on students and say, This is what you need to be able to practice safely and really help serve your patients. But it's on you because you need to learn how to be a lifelong learner as an advanced practice registered nurse, right? No one's going to tell you that the guidelines have been updated and you're not practicing evidence-based. You have to be able to really do that. So we teach a lot of that about how to be a clinician, not just pass your boards. That's one of my big passions, and that's just the overall community here at Archer. So definitely feel free to scan and get a demo. Check out our products. If you go on our website, this demo, it doesn't show you our products, but you can always go to archerreview.com. You can email our sales team with any questions. You can email me at hiva.kolodrubetz@archerpulse.com. But we are so grateful you guys joined us today, and we loved all the engagement and interaction. Thank you to Dr. Tracy Hicks for being our guest speaker. Thank you to Rachel Taylor for being our wonderful director of nursing and bringing all that perspective. And yeah, anybody else want to say anything before we wrap up for the day?
I just say thank you to everyone for your attention and time. Time is something that we don't get back, so how we use it is very important. So have a great day.
I love that, Dr.
Thanks,
Hicks.
everyone.
Time is a gift. Yeah, that's so true. So thank you, everyone. Thank you again, Dr. Hicks and Rachel, for being on today. And we'll see you next time. Happy
Bye.
holidays, everyone.